Assalamualaikum and very have a good day to Madam Siti Noraima binti Muhammad Fuad. My name is Muhammad Kasim bin Abdullah. My metric number is P20412211001. Today I'm going to do my PSPG 4223 assignment 2 cohort 19 for Otitis media. So it's me, Muhammad Kasim bin Abdullah. Next. So in this topic, we're going to go through the introduction, cause of otitis media, risk factor of otitis media, types of otitis media, complications, and treatment of otitis media. The treatment of pharmacological and non-pharmacological treatment. Let's move in. So, otitis media is information or infection of the middle ear. The middle ear is cavity between the tympanic membrane, the eardrum, and the oval window of the inner ear. Its function is to amplify sound vibration of the eardrum and transmit them to the inner ear. The middle ear is linked to the upper throat by the auditory tube or eustachian tube. The tube helps equalize air pressure between the middle ear and the outside atmosphere. It also drains mucus secretion from the middle ear into the throat. The eustachian tube is usually closed, opening only when the person is yawing, swallowing, or chewing. When atmosphere pressure changes rapidly, causing a sudden feeling of fullness in the ear, such as during airplane travel. These activities can be done on purpose to open the tube, allowing air pressure to equalize the pressure. Otitis media develops when the eustachian tube is blocked, commonly as a result of a upper respiratory tract infection or allergies. Mucus build up in the middle ear, creating an environment for bacteria or virus to grow. So next. So the common causes of otitis media is streptococcus, pneumonia, Haemophilus influenza, Moraxella catarrhalis, and the virus cause of otitis media is respiratory synthetic virus, coronavirus, influenza virus, adenovirus, human metapneumovirus, and picorona So next. The risk factor is the young age. So, otitis media can be acute at any age, but it is most common in small children whose effusion tube is narrower and more horizontal. The tube open mechanism in children is also less efficient due to the angle between larger adenoids, the pad of limonoid tissue located near the opening of effusion tube. Adenoid swelling may block the tube's opening. So, the other risk factor includes exposure to smoking, male gender, family history, pacifier use, bottle feeding, and attending a daycare center. So the breastfeeding is the instead of the breastfeeding, and the smoking is the major factor. So young age is like 80% of children have otitis media at least once. The most common age between the most common age for otitis media is between 3 months to 3 years. So we move to the next. The type of otitis media. So the type is acute otitis media. So what acute otitis media does? So acute otitis media is an infection that develops suddenly. Fluid and pus accumulate inside the ear. The tympanic membrane appears red and bulging. Patients typically experience fever and ear pain. In some cases, the eardrum may rupture and the ear may drain. So the next is chronic suppurative otitis media. That's the long-term otitis media. It has it is an infection that doesn't go away or occur repeatedly. Tympanic membrane perforation and ear drainage are common features to this case. So hearing is usually impaired for this case. So next is the otitis media with infusion. Is when fluid continues to accumulate in the middle ear even after the initial infection subsides. Patient may experience a feeling of fullness and impaired hearing, but there are no sign and infection when the fluid remains for an extension period or time or returns repeatedly. The condition is known as chronic otitis media with infusion. So let's move to the types. Okay, let's move to the complications. Sorry, I'm so sorry to the introduction. Right. Okay, next. The complication is eardrum rupture. The most spontaneous, only few cases need surgery defect, hearing loss, speech language development delay, infection spread, rare intrathecal. So the primary complication of ear infection is eardrum rupture, which heals spontaneously in most cases without the need for surgical repair. Untreated recurrent or chronic infection may lead to hearing loss, speech and language development, as I said just now, development delay, and rarely the infection spread to the surrounding tissue, including the brain, as a rare complications. So let's move to the next. So the treatment. So there was two treatment. One is pharmacological treatment. Another is non-pharmacological treatment. So as we know, pharmacological treatment is we treat with medication, and non-pharmacological treatment we treat use other alternative ways such as surgery or alternative medicines, obat traditional, something like that. So let's moving. Treatment to acute otitis media includes pain medication and possibly antibiotic because the majority of ear infection resolve without antibiotic treatment. Children with mild symptoms are usually observed for 48 hours before the antibiotic one prescribed. For cases with prolonged infection, a tiny tube may be placed in the eardrum to help drain the fluid. The tube usually falls out on its own after some time as the initiation closes. So as we can see here, the treatment that has been told to acute otitis media is antibiotic, but for child, they will be inspect for 48 hours before they prescribe the medication to the child. So if non-pharmacology treatment for the prolonged effusion such as the chronic one like that, so they will use the tympanostomy tube or myringotomy tube. So we can see in the picture that they insert it into the eardrums. Yeah. So next, this is the example medication such as ibuprofen, augmentin, amoxicillin, and the pain reliever, acetaminophen. So this is the medication that we use for this media. So thank you very much, madam. Have a nice day. Assalamualaikum warahmatullahi wabarakatuh, and see you, madam.